speakers. So welcome to the third session of Delaware Mini-Med South, which we're doing in partnership with the Sussex County Health Coalition. I'm Tim Gibbs with the Delaware Academy of Medicine, Delaware Public Health Association. Here are our various social media badges here, and hopefully any of you who have been interested in those have liked and followed or otherwise engaging with us. Just to review, I'm going to do this quicker each session now. We've been around the Academy since 1930. We restarted Mini-Med in 2009. It ran in the 1970s and 80s for a while. Sussex County Health Coalition is our partner. Representing them is Christy Handley. These sessions are all part of Delaware Health Force, which is an ARPA, American Rescue Plan Act funded initiative to get more people interested in healthcare and public health as professions. There are no tests or grade in this. This fall session is the last fall session of this year. There will be sessions starting again in February. Christy, is that right? Yep, in February.
That's correct.
And for any of you adults online, just to remind, there's no continuing medical education, no continuing education credits available. Hopefully, if you're here for your own edification or your parents of the kids who are attending. For participants who attend all 6 sessions live, meaning you're with us now and you're with us at the end of the presenter's presentation. You don't have to stay for the Q&A, but you can simply sign in and then sign out a few minutes later. We watch all that. You will get a certificate of achievement. And for those who want to do what we call a reflection paper, then you can become a member of the Delaware Youth Medical Academy. Our goals are simple. We want to increase health literacy in the community, in you all. We want to ignite your interest in public health and the life sciences, medical, nursing, dentistry, and so on as part of your own career goal setting. And we're sharing career pathways with you all. Each of the presenters is going to talk about how they got to where they are. And also in the Q&A portion, which happens at the end, remember, you can ask questions during the presentation. However, the presenter will not be stopping to answer them. We'll be answering some of them. Others will hold on to until the end. And it's a safe space to ask questions. Just make sure that the questions are not of a personal nature for your own health or of a personal nature about the presenter themselves and asking how much money they make or something is not appropriate. Delaware Youth Medical Academy. Here's the program and how it's laid out. For each session you attend, you get points. If you get a total of 90 points, which means you do 3 series, you're eligible to attend the Academy DPHA annual meeting as our guest, and we'll be talking about that a little bit further downstream. Housekeeping tips. This is a Zoom webinar. You can only see us. You can't see each other or communicate with your classmates. We're sorry about that, but this is the best way to run it. Only use the Q&A feature to ask your questions. As I said, don't ask questions of a personal or family nature. It's a violation of HIPAA, and all of us who are leading this it wouldn't be good. All of your questions will be addressed, some by myself, some by Christy. Others will hold for our presenter this evening. And as I said, you need to stay through the whole presentation, but when we get to the Q&A, if you want to leave, you can. I will tell you that a lot of the really good stuff comes out in the Q&A. So we are 2. So you want to work in pediatric nursing, and I'm going to turn it over to Christy to introduce this evening's speaker. Christy.
Great. Thanks, Tim. Good evening, everyone. We're glad that you could join us this evening. This evening we have Taryn, who will be, and I'm going to butcher her last name, Pariag.
Yes, close.
joining us this evening. Taryn has obtained her associate's degree in nursing from Delaware Tech Community College in Stanton, her bachelor's degree from Wilmington University, her master's degree in nursing leadership with an education concentration also from Wilmington University. She's a certified CPR instructor, a certified pediatric advanced life support instructor through the American Heart Association, as well as a clinical simulation lab instructor. And I'm sure if you have any questions, she's going to answer any of that for you at the end of her presentation. Taryn has worked as a pediatric nurse in a level 1 trauma center for 21 years in critical care management, forensic nursing, and post-anesthesia care unit, which is the PACU. She has worked in hospital-based practice committee as a chair-elect for 1 year and voting member, helping develop policies and procedures. She's a member of the Delaware Nurses Association and the American Nurses Association. She is a member of Sigma Theta Chi International Honor Society of Nursing. She has received the Preceptor of the Year Award in 2006 and was a finalist in the Delaware Excellence Awards in clinical practice in acute care in 2016. During her time at the hospital, she championed a multidisciplinary work group to develop an education book titled The Family Home Care Training Manual for the Caregivers of a Ventilator-Assisted Child. It is now used to educate families. And in 2009, her work group actually won an award for interdisciplinary relationships for the development of the educational material that we just mentioned. As a clinical educator at Beata Pediatrics in Newcastle, Taryn is responsible for all onboarding and education of new staff, clinical management, and providing all the education for the nurse residency program, including simulations and new graduate nurses. Taryn, we welcome you. Thank you for joining us.
Thank you. So first, I'd like to take the opportunity to thank you both for allowing me this opportunity to present. I'm going to share my screen. All right.
You've got it.
There we go. Okay, so just a little nursing humor here. I'm sure my kids would agree with you about this little meme here. You can't fake sick with me. Mommy's a nurse. So just a little bit about the agenda. I'm going to talk a little bit about the history of nursing, my nursing timeline, and how I became a nurse and where I'm at today, why I became a nurse, and then some of the challenges that I've run into as a pediatric nurse. So a little history of nursing. This is, if you don't know who she is, this is Florence Nightingale. She, she started nursing. She was known as the first professional nurse. She was known for her patient safety advocacy in both the war back in the 1800s. She developed a lot of the patient safety outcomes for and actually saved a lot of the war heroes back in the day by developing patient safety standards, infection prevention things, those kinds of things, and started the nursing realm. She also has a pledge that is still used to this day. I know I used it when I graduated nursing school. Some of the nursing schools are still using it through graduation. And this is the pledge that they actually use and they speak when they get what they call pinned at a nursing ceremony. So my timeline of nursing, I was not going to be a nurse. I hated needles. I hated blood. I didn't want any part of nursing. But then I graduated from Hudsonville Tech as a cosmetologist, right? Everybody wanted to be a cosmetologist back in our day and wanted to do hair. And I went out and did hair, and I was working at a nursing home for a little while and absolutely loved taking care of the elderly, loved hearing their stories, their histories. I really enjoyed spending a lot of time with them. And as I was there, I developed a lot of relationships with both the nurses there and the nursing assistants. They would come in, they would talk to me, they'd, bring the clients in for me to do their hair. And we just got to chatting about, their careers as a nurse. This kind of developed my interest in becoming a nurse. But obviously I didn't know where to start. So after lots and lots of communication with the people at the nursing home. I really developed that love for healthcare with the geriatric population. So I decided to go back to school and get my certified nursing assistant certification. After that, I worked in a nursing home for a very short period of time. I worked as a CNA at that same nursing home that I was doing hair in. And then I decided to transition into a pediatric medical daycare. Still around, was there for about 6 years as a nursing assistant and absolutely loved peds. Decided to go back and further my career. I wanted to do more. I didn't want to just be a nursing assistant. Not that to make it sound like they don't do anything, because they are really the heart of both, nursing homes, medical daycares, those kinds of things. They do the brunt of the work in the healthcare world. But I really wanted to do more. And I felt like as a nursing assistant, I was kind of stuck where I was and I wasn't really learning anymore. So I really decided I tried to get into the program at Del Tech. At that time, everybody was in Del Tech and everybody wanted to be a nurse. There was a 5-year waiting list, I believe, for the clinical piece. And I didn't want to wait 5 years. I wanted to get it done. I wanted to be a nurse. And once I set my mind to something, I need to get it done. I'm not a quitter. So I really found other options. And that option was a community college over in New Jersey. It was over in Pennsville, I think it is, right across the bridge. They had an LPN program. And the LPN program ran for about 10 months. And I could still be a nurse as an LPN. Couldn't work at the time, they weren't allowing nurses in the hospitals, but I could work in a nursing home just like I was before. And so that's what I did. I went over to Salem, New Jersey, and I became an LPN in about 10 months. I then went back probably about when I would say 23-ish, to school to get my RN when things kind of slowed down a little bit. And I was able to get into the clinical. And because I was an LPN already, I was exempt from the first year of clinical. So it only took me about 10 more months to get my RN degree, which is what I did at Del Tech. Graduated from there in 1999. I started working at AI in 2000. If you're not familiar with AI, it's a level 1 pediatric trauma center. They didn't start out as a level 1. They started out, I believe, as a level 3 and kind of went from there. During that time frame, I had held many roles. I started out on a step down floor that took care of mostly trach and vent babies, spinal cord injuries, brain injuries, lots of respiratory children, lots of motor vehicle accidents, kids that needed intensive rehab that would be there for weeks and months at times. 2004, as was mentioned earlier, I did win the Preceptor of the Year award. I was nominated for, I was big on education, big on teaching, wanted to teach as much as I could to as many people as I could to make better nurses, and to provide better care for these kids and their families. 2005, I did become the assistant nurse manager on that unit. And so it kind of took me away from the bedside. I still was in the bedside, because obviously they always needed help, whether it be for an emergency or someone coding or just in general, someone needing help. I always was willing to step up. So I did have that bedside piece as the assistant nurse manager, but it wasn't on a full-time basis like I was before. But I did love the management piece. It gave me that little bit of management experience as well as the bedside piece. Again, as mentioned before, I did lead a work group that developed, and this is actually the cover of that book that we developed for Nemours, and it is still used hospital-wide. So this was developed because we had the NICU, if you don't know what that is, that's the neonatal ICU, the pediatric ICU, and our unit, which was considered the step down. And as these children were being they had to be given trachs, they had to be put on ventilators because they were either born too early, they might have had an injury of some sort, and they had to be put on these ventilators. And so all of these 3 units were teaching in much different ways on how to take these children home. And so we decided to develop this work group that included members from the ICUs, both the neonatal and the pediatric, as well as my unit, as well as physicians, social workers. It was a multidisciplinary team that developed this binder and this workbook so that everyone was teaching the same way, and these parents were getting that consistent education to be able to care for these kids. These kids were extremely fragile. They needed a lot of supervision. They needed a lot of care, whether it be with the ventilator, with the trach. They needed suctioning. It took a lot to get these kids home. Their normal training session was about 6 weeks. That was if they were doing really well and showing up for their appointments. And it could have been, you know, as long as a couple months. It really depended on the families and how they participated in the training piece. But this did win an award, as mentioned earlier, and I'm very proud of this book. This was a huge accomplishment for me. In 2009, I did become the nurse manager for that unit as well. I became the interim nurse manager. The nurse manager that had left had been promoted to a director position, and she had asked me if I would step up and do the interim. I was very hesitant because I really wanted to be at the bedside still. I didn't want to get away from that bedside piece and be able to teach and educate these families and these nurses. But I did it. I took one for the team, and I became a nurse manager. And I did that for about 19 months. And they finally, at one point, said, you know, we found somebody that is going to replace, you know, obviously be the permanent nurse manager. So I went back down into the assistant nurse manager role, which I was very happy to do, and was back at the bedside again. If you know Nemours or AI DuPont, they built a brand new hospital. When that hospital was built, the unit I was on dispersed into multi-units. It became the population became both an ortho rehab population. It became a step down. It became a neurology unit. So what they did is there was no more of that specific unit, and they dispersed that unit into 3 separate areas. I wasn't willing to choose one of those areas. So that's when I transitioned back into straight bedside nursing into the recovery room, which is considered the PACU. During that time, I obtained my BSN at Wilmington University while I was in the PACU. And then in 2013, I decided to pick up some part-time hours in the emergency room as a forensic nurse examiner. This had to be, I would say, one of the hardest jobs I've ever done. This job pertains to caring for children that have been both physically or sexually assaulted. We saw a lot of children, and it was a very sad job. I did it for about a year, and I just couldn't do it anymore. My heartstrings were torn. I just really couldn't focus on, I started to not love my job, and I started to really not enjoy people. And so I decided to back away from that position and went back to just doing my recovery room nursing. 2021, I left the hospital after 21 years to become a clinical educator at a pediatric home care company, which is where I am now. My heart, my life, and my role as a nurse is to teach and educate both parents, nurses, staff members. That's really where I belong. It's what I do. It's what I love. And I've been doing it at Beata now for about 6 years. I just graduated in April with my master's in education, again, from Wilmington University, and have enjoyed every minute of this role. So this is my why. So these are some of my clients, and I do have, just to kind of put it out there, I did get permission from these families to be able to share this with you. So again, after 21 years, I left that level 1 trauma center, and I saw the worst of the worst when it comes to children. You know, some days were extremely hard, but the good days definitely outweighed the bad days. You know, to be able to see a child come through an ER maybe after a car accident, not able to walk due to a brain injury, and a few weeks later, possibly walk out of that hospital is so worth the challenges that they have to overcome during their hospitalization. The big thing with nursing, and again, this is part of why I have become, involved in a lot of these nursing organizations, both the Delaware Nursing Association, the American Nursing Association, and the Sigma Theta Tau, is just because you really have to advocate for these kids. Yes, they have parents, but you have to kind of separate your role as a parent, and I am a parent, from that nursing degree. But you do get close to them, but they need that advocacy. And to do that, you have to be able to get involved in the community. I just actually, the Delaware Nursing Association did reach out to me and did ask me to publish an article in December's editorial regarding nursing and how can we recruit more nurses and how can we get more nurses to want to do home care, because it's just where we need those nurses to work. We have as you all know, there's a nursing shortage, and we'll talk about that a little bit later. It's everywhere. It's not just hospitals, it's everywhere. So you really have to get involved and be advocates for these kids to be able to get the right people in the right places to care for them, especially in home care. Home care is great, but there's so many specialties you can do as a nurse. You can do pediatrics, you can do family practice, you can do psychology, you can do neurology. There's so many opportunities as a nurse and where you would like to work. You can do public health. It's just a plethora of opportunities as a nurse. But some of the things that you do have to consider as well are ethics, culture, and beliefs. There's a lot of cultural things that you have to be aware of when you become a nurse, because we do have to make sure that we are providing the right accommodations for people that do have cultural beliefs. I just remember specifically in the hospital, we had one family that had to have the bed a certain way because they had to be in a certain area of the room when the sun came up or down. So these are the kind of things that you really have to take into consideration when you do become a nurse. But these are two of my kids right now. Actually, one of them is one of my children that I take care of right now. The one on the right, that's Caden, and that's his nurse, Ashley. And she won a hero award for taking such good care of Caden. The little girl is Harper. This was my angel. She passed away, unfortunately. This March will be 2 years. But she was I had her since she was a month old, and she was 3 when she passed. But these are the kind of kids that I absolutely love taking care of. These are two more. This is Jonathan with all the shaving cream all over him. And this is Lily. She's a diabetic. Again, some of the conditions that we take care of are diabetes, brain injury, respiratory disease that requires trachs and vents, genetic mutations, cerebral palsy, spinal cord injury, and injuries due to abuse. There's so many things that we see being a nurse. This is just kind of a little motivational thing that it's hanging in my simulation lab that I have for my nurse residents, any new employees. And it just kind of gives you a different perspective about some things that people talk about. So if you fail, never give up, because fail means your first attempt at learning. End is not the end. In fact, end means effort never dies. And if you get no as an answer, remember no means next opportunity. So these are just some things that I put in my simulation lab as a nurse to be able to encourage other nurses or nursing students or new graduate nurses to never give up, to just keep going and want to do more in their nursing career. I did put some equipment that we have in our sim lab here, just so you can kind of see what that looks like. This bottom picture here is a ventilator. So this would be connected to this little guy here. This is how they breathe every day. Some kids can be off of it for certain periods of time. Some kids need it all the time. So it really depends on their condition and their health. The top one here right above the ventilator is actually a suction machine and a nebulizer. And then there's a couple things over here. This is called an ABI vest. This is how you do chest physical therapy. So if you have congestion or They really need to kind of get some things out of their chest. It's a vest that vibrates and percusses and gives them that opportunity to get rid of that stuff. And then the one above it is, it's called a cough assist. And what that does is for kids that say have maybe some spina bifida, they might have cerebral palsy, and they don't have that productive cough that you and I may have, and be able to get those secretions up. That's a machine that will do that for them. So some of the challenges as a pediatric nurse, it's really hard to see children hurt. But again, the positive outcomes are what makes our jobs so worth it in the end. Some nursing interventions that influence healthcare outcomes are for individuals, populations, systems, it has to be what drives our nursing practice. And with not having enough nurses for the number of patients, this will affect the quality of care you're providing. So we want to make sure we try to encourage, students or nurses that aren't sure what practice they want to do, to kind of guide them in the right direction on where they need to be to help provide care to these patients. Equipment's always changing and evolving, so it's super important to make sure we keep up with our skills yearly. We have to have 30 CEUs every 2 years to renew our nursing license. And it could be conferences, it could be online, it could be something like this that does have CEUs attached to it. So there's multiple things we have to do that in order to keep our license. Again, some more pictures of the simulation lab. This is our monitor for the nurse residency program that we have, and this is just like a monitor you would see in the home. This is our adult simulation lab, and this is our pediatric simulation lab. So these are just some of the things that we use every day in nursing, as I am an educator and I use this dial pretty much weekly. And this is just kind of a little Christmas humor, just because we are so short in the nursing field. The little girl's asking for, I want a dragon. Santa says, be realistic. She says, okay, I want a fully staffed nursing unit. He says, okay, what color do you want your dragon? Knowing that it's so hard to get the right nurses in the right places. So these are some statistics that I just wanted to bring up to show you how much of a need there is for nurses. Nursing is documented as one of the most trusted professions by the Gallup poll for 18 years in a row. That speaks volumes. Yet we're in a nursing shortage. We are the most trusted profession, but we're in a nursing shortage. It just doesn't make sense. According to the State of the World's Nursing report, there was a global deficit of almost 6 million nurses before this pandemic hit. And for the next 10 years, 1 in 6 nurses in the world is expected to retire. That means 4.7 million new nurses will have to replace them. That's a lot of nurses. So think about how that affects both if it's you or your loved ones and the care that they're going to get due to that shortage. It's going to suffer. So what can you do to help? Become a nurse. These are just my children. I just wanted to throw this in there because, again, this is my why. This is my son and my daughter, and my son and myself, we both graduated at the same time. He graduated from high school, and I just graduated with my master's just this spring. So. And that is all I have.
All righty. Thank you very much.
You're
All
welcome.
right. So now it's Q&A time. Just wanted to fill in a couple of blanks for people, those of us who are in the industry and the profession sometimes use abbreviations that we know exactly what we mean. When Taryn was saying AI, that's Alfred I. DuPont Institute for Children, now called Nemours, but depending on who you talk to, there will be a different name for it. So we're not talking about artificial intelligence. We're actually talking about the Children's Hospital. I did sort of go, wait, what is she saying? But in any event, all right, let's see what kind of questions that we have. Abigail asked, what all was involved with forensic nursing? You mentioned it was hard, but what are the challenges of it?
Wow. There's so many. So I did spend, I spent a week out in, Duluth, Minnesota. I was flown out there by the hospital to do the educational training that I had to complete. I came back to the hospital and I did have to train with another forensic nurse examiner for probably about 3 months because the documentation was just unbelievable. It had to be because you're dealing with police officers, you're dealing with possibly the medical examiners, you're dealing with courts. I did have to testify a few times in some court cases that were brought, charges against the offenders. So there was multiple challenges. The biggest part, I think, for the challenge for me was trying to keep an open mind and not pass judgment on the offenders that were doing these deeds to these poor children. That was a huge, huge challenge for me. And that's actually why I got out of it, because after a year, like I'd said earlier, I really started to not enjoy people just because there were so many people that were harming these children purposely. And I had to back away. That was probably my biggest challenge during that year of that position, was to not pass judgment on people that were hurting children. But
Right.
for educational purposes, it is an intense amount of training. There also is a certification that you can do once you've completed that training. I did not do that certification only because I hadn't done it for that long. You have to be doing that job for a very long time in order to sit for that certification. It's called
Right.
a SANE nurse.
Yeah, I think the other thing about forensic medicine of any type, having talked with medical examiners and other people, is that there's almost always an element of something bad happened, or there's a mystery to be solved that was probably the result of something bad happening. You hear about human remains being found, and it's the forensic, experts of all types who actually get in there and figure it out. So, yeah. A question that one way or another we seem to get frequently is, can you become a pediatric doctor after working as a pediatric nurse for a couple of years?
Absolutely, if you go back to medical school.
And there's the big if. And why would you want to? Just kidding.
Yes.
Right. Just a reminder too, for those of you who are showing up as anonymous attendees, make sure that you drop an email to tgibbs@delamed.org. Christy will put that into the chat, and just let me know which anonymous you were. Anyway, thank you very much, Christy. As a pediatric nurse, is it hard to see patients pass once you've gotten close to them?
Absolutely. Harper's the prime example. One of the pictures I showed earlier, I was very close to her family, very close to her. She was like my child. I'd taken care of her since she was a month old. Like I said, she passed when she was 3 years old. I still to this day communicate with her parents. They were at my son's graduation party. So I do dinner with her at least a couple times a year. Yes, it's extremely hard to watch these children pass, but you also have to look at it in a different way, that you're helping them and their families during the time that they're here. You kind of have to look at it in an optimistic way as best you can, that you're providing their families and them with the best care that you can. You have to be compassionate. You have to be patient. When I first admitted Harper into our service, it took a long time for me to be able to have a conversation with her mom without her mom crying, knowing that one day she was going to pass. And her life expectancy was extremely short. They didn't expect her to live past her 3rd birthday. She died 2 months after her 3rd birthday. So these are the things that you really have to take into consideration as a pediatric nurse. You kind of have to set yourself up to be very strong and try not to be emotional. Did I cry with mom the day she passed away? Absolutely, I cried with that mom. But that just shows that I cared about her. And she was, you know, like I said, she was like my only child. She was one of my children.
Right. Well, and I think that one of the other things too, and for those of you who are thinking about a career in public health or in medicine, this is universally true. There's a fine balance that we all walk between, maintaining an appropriate level of emotional distance, and yet being emotionally open to,
Absolutely.
whatever the situation is. And there's this whole sort of dark medical humor that goes on, in particular, I think, between medical providers and hospitals. And to the outsider, it sounds pretty awful, but it's actually a internal protection mechanism. It's a way of venting off what can be some overwhelming emotion.
Absolutely.
And, especially if you're working in the emergency department where, it's fast and furious and, you barely put one fire out and another 3 pop up.
Yes.
Right. So these are all sort of clustered together. Great questions are coming in. Work-life balance. How much time do you spend being a nurse in a clinical setting, and how much time do you spend being a person outside of nursing?
That's a great question. And I don't know that I could answer that question. I definitely take my work home with me. I am a very strong-willed person. And so if a parent reaches out to me, the parents do have my cell phone because I am a clinical manager as well. So I do manage cases. They do have my cell phone. They do text me and call me after hours. But I mean, I do try to make sure that my weekends are my free time. I am a Monday through Friday, probably 24/7 person, at least working or on call, but my weekends, I try to make sure that if I'm not on call, if I'm not on call, I try to make sure to do something that is me related. Whether that be reading a book or, just going outside and taking a walk. I try to do that at least on the weekend. So I would say I put in, a good amount of time during the work week, but then the weekends are really my downtime.
Right. So for you, so one of the things that you all have heard me talk about before is about stacking of degrees for nurses. So you've done some stacking.
I have.
And the question arises, so what was the most difficult of your various degrees and certifications, and why?
My master's was my most difficult, and it wasn't academically difficult. I had some pretty significant life experiences during the 2 years that I was finishing my master's degree. I lost my brother at the age of 49. 6 months later, I lost my best friend to breast cancer. So I think that academically, it was not a challenge, but you kind of have to, life happens, and you have to kind of, when you put your mind to something, you have to keep going and try not to let that hinder or obscure your view of what your future is going to look like. And I have 2 children. I was a single mom. And so for me, that it just made me work harder because I wanted my children to see that even though life happens, you have to keep going. Yeah. And you have to, if you have a goal that you've set for yourself, you have to keep going and get to that goal. Don't give up, because I could have easily given up after losing my brother. I lost my world. But I thought to myself, he would not want me to stop. And so you kind of have to separate that and think to yourself, if you set that goal, you got to get it done. It's that simple.
Right, right. Thank you for sharing that. So I'm going to put these two questions together, even though they're a little bit different. Number one, do nurses always work in hospitals? And then related to that, what about travel nurses? Are there travel pediatric nurses?
Absolutely.
And go.
There are, no, there's not, you don't have to work in a hospital. I did not start in a hospital. I started in a pediatric daycare as a nursing assistant, and then I went to a nursing home. You do not have to start in a hospital. The hospital is more of, yes, should you get some med surg experience, meaning that hands-on, plethora of conditions, whether it be respiratory or seizures or cerebral palsy. Yes, that gives you the experience, but you don't have to start there. I work for a home care company. We have new graduate nurses that come through the residency program all the time that didn't go to a hospital first, but they knew that they wanted to start with pediatrics, but they didn't want to work in the hospital because, as you know, there's a nursing shortage. And so the nurse to patient ratios are much higher now. You don't get that quality time to spend with your patients. You're probably taking care of 10 patients instead of one patient in, doing home care. So it's a balance. It's really what you're looking for and what you want to do with your degree. There's also, you can work in public health. You can work in a doctor's office. The one challenge, though, with not having the experience from the hospital are some places won't hire you without some form of medical surgical hospital experience, because that's where you get that critical care thinking. That's where you get that the choices that you have to make have to be urgent, but you don't have to start there. The other question was, I'm sorry, can you repeat the second question?
Well, pediatric travel nurses.
Oh, yes, there are pediatric travel nurses all over the world. I get probably text messages on a daily basis about travel nursing positions that they're hiring for. But again, it's a work-life balance. So those travel pediatric nurses usually do, it's a specific amount of weeks of assignment. It's usually about 13 weeks. You travel, it's a great way to see the world. If you're single and you don't have any responsibilities at home and you don't have children to worry about, absolutely. You can do pediatric travel nursing. But again, if you don't have that experience, travel nursing, they put you in probably some of the largest hospitals in the country, or they might put you in an ICU somewhere. You really need that experience before you do that travel nursing.
Right. And then there's the travel practice for nurses and doctors and, everyone that occurs overseas, which is yet another level of complexity with understanding the cultural norms and differences, and it's a lot. So another two that I'm going to sort of loop together. If you had done all of your schooling to get where you are now, all at once with no breaks in between, aside from probably being 6 feet under, how long would that have taken you?
Wow. If I did it straight, I would say probably 12 years.
All right.
Between the nursing assistant, the LPN, the RN, actually probably a little longer because I did nursing assistant, LPN, RN, BSN, MSN. So I would say probably 12 to 15 years if I did it straight in a row. I don't know anyone that would ever do that. You have to take a break. You really do. You can't. I mean, if you're young, that's great. You could probably do it in that amount of time. But one, it's financially, it's expensive. And you can work. For my BSN and MSN, I did that part-time. I did one class each 7-week block. It took me about 2 years to finish my bachelor's and about a year and a half to finish my master's, because I did do graduate classes in my undergrad program. So I was able to knock some of those out during that undergrad program. So it was less I had to take in the graduate program. But I could have never done it at a full-time basis. I mean, I had to work again. I was a single mom, so I had to have a job and pay bills. And so my BSN and MSN I did on a part-time basis. And like I said, I did one class every 7 weeks, and it worked out for me. It was a nice break over the summer. Christmas break was nice. You got breaks in between.
Right. So there's a question here that Aisha asked, which is, I just realized how interesting of a question this is. We talk about nursing education, you LPN, RN, MSN, and whatnot. But what do you do in particular to become a pediatric nurse as opposed to a geriatric nurse or a family practice nurse? What do you actually do in the education that differentiates you into being a pediatric nurse?
So as far as the degrees go, it's not a specific specialty. I have my bachelor's degree in nursing. I have my master's degree in nursing. It's not a pediatric bachelor's degree. It's not a pediatric master's degree. My pediatric comes from my experience. There is a certification, a pediatric nursing certification that I, for some reason, I just don't know. I never took it. I probably should, as long as I've been a pediatric nurse. But there is an option to become a certified pediatric nurse. And that is a certification that you sit for. It's online, just like your nursing boards are. But you take a class ahead of time. There's actually a book that you can buy and study with that book and sit for the certification. But there's really no, as far as my degrees go, none of them are specific to pediatrics, other than my master's degree is specific to nursing education. And it's only pediatrics because that's where all of my experience has been most of my nursing career.
Gotcha. Okay. Would a minor or a major in criminal justice help in this pathway? And what I'm not clear on is whether this is a throwback to the forensic question or not. So a little bit out of context, but go with an answer anyway.
Yeah, if it is related to that forensic piece, I think absolutely a minor in criminal justice would help tremendously, because I did not have that, and dealing with the police officers on a daily basis. If we had, kids that came in, we had to turn over forensic evidence. If they were physically or sexually assaulted, we had to bag clothing and we had to label everything. And so, yes, that would probably help significantly if you decide on doing anything with forensics.
Right. Is it possible to get too invested in a patient's case?
Absolutely. You have to set boundaries. You really do. And I think that the way to know if you're too involved in a case is if you're starting to make decisions not based on safety, not based on the quality of care that you're providing, or if you're getting emotions involved, right? So if you're getting emotionally involved and you're not making the correct decisions because you're emotionally involved, it's time to step away.
Yeah. So I'm going to lump another two together, one from Abigail, one from Carly. So what's your favorite part of pediatric nursing, and how many of your patients fully overcome their illness?
Oh gosh, that's a very loaded question.
I know, that's why I put them together.
So my favorite part of pediatric nursing is, again, just developing these relationships with the families. I've developed such long-lasting relationships that, there's kids that I still see all the time. And I'll give you an example. I have a little guy that was a physical abuse case. And I took care of him and then at the hospital, and then he ended up coming home, getting home care. I took care of him in the home care piece, and he was discharged because he was doing so well. He has some residual effects from it, but his mom just sent me last year. He graduated from kindergarten. And so to see stuff like that, that's my favorite part of pediatric nursing, is to see where they are today. Another example is I had a little boy that I had him since he was a little baby. I think he was 2 months when I got him. He was trached. He was vented. I used to call him my code blue baby. He would literally code on me every single week. I would have to bring him back to life. And so I just received 2 years ago from his mom. He no longer has a trach. He's off the ventilator. He just graduated from high school. So those are the kind of things that I think is my favorite part of pediatric nursing, is to see that me being a pediatric nurse and caring for this child the way that I did, I think had a little piece in the outcomes of where they are now. And so that makes me feel great about what I'm doing and that I'm in the right place.
Right.
As far as the amount of people that have I seen loss, absolutely. But like I said before, the positives outweigh the negatives, and I've seen a lot more positives than I have negatives in my nursing career.
Right. I think the other thing that comes into play here is that when, in addressing the question of how many kids get better, what does better actually
Right.
mean, and how complex was their case to begin with?
Right.
So it's always relative, and I don't remember where this quote is from, but some people will always need help. That doesn't mean that they aren't worth helping. There is you get people to a point, but that they will come back into the system. You'll need to see them again, and this is in fact a big challenge with pediatric to adult care. These transitions of care across age, especially with congenital birth defects and various things. It's complicated when you age out of the pediatric side, and all of a sudden adult practitioners are responsible for taking care of these now adults, and they don't have the background with them. They don't have the experience. It's complicated stuff, but that's where a lot of the really cool stuff is also going on. How is pediatric nursing different during the pandemic?
Wow. It wasn't. It really wasn't any different. I do think that we didn't see as much of it as the adult hospitals did. I think it definitely affected more of the adult population than the pediatric population. Did we see it? Absolutely. I was actually, I can't remember if I was not working at the hospital when COVID hit. I was at Beata at that point. And we saw it at home too, because these kids have other comorbidities and aren't, healthy already. And so they do have their immune system's not great, right? They catch every germ imaginable. They go to doctor's appointments, or they have siblings that go to daycare and they bring things home. And so, yes, we absolutely saw COVID. It didn't stop us. We were geared up just like the rest of the hospital was. We were in full PPE, N95, still caring for these kids.
Right. What about RSV, which has been big in the news recently?
Yep, it's actually coming back around now. Wintertime, and we see a lot of RSV. I do give, there is an immunization called Synagis that we give in the, usually in the fall. And it's given to kids that are usually susceptible to RSV because they're probably born premature, or they're born and their lungs haven't developed. So we do give this series. It's a 5-series shot once a month that we give, called Synagis. And we usually start it in, I would say, September, October area, and it runs until usually February. But even with them getting the Synagis, we're still seeing them get the RSV. It might not be as bad as they would have got it had they not gotten the Synagis, but we're still seeing it for sure.
Right. Let's see. Well, you can see these questions too. You could probably quickly knock them out. It's about how long does it take to get a BSN if you graduate from high school with a CNA? How many years to get an LPPN degree? And I'm probably going to get the put into the chat a link to Nursing World and their sort of taxonomy, their flow chart of how to pursue a degree in nursing unless you've got something better, because that really spells out durations pretty well. And all of that's assuming that you're going full bore full time. But anyway, over to you.
Yeah. I would say, so for how long does it take to get a BSN if you graduate with your CNA? I would say probably another 4 years. It's just like your typical bachelor's program. And then how many years of study is the LPN? The LPN course was 10 months. I did it, like I said, over in New Jersey. I don't know if there's any LPN. I know Delaware Skills Center has one. But in Delaware, I'm not sure of all the LPN schools, but I know Delaware Skills Center has one. We do get those students in Delaware. Typical shift hours for nurses, I would say they're both 8 at the hospital. They're usually 12-hour shifts. You go 7A to 7P or 7P to 7A. There's no other option. But in any other facility, doctor's offices, home care, public health, it's usually probably 8 to 10-hour shifts. We do have in home care, we do have some 10-hour night shifts. We have a couple 12-hour day shifts, but those are kids that are pretty complex. They have trachs and vents, and their coverage is pretty high because they are so complex. Common
diagnosis.
Oh gosh, common diagnosis. I don't know if there's a common diagnosis. I would say we get a lot of children that have something called BPD. It's called bronchopulmonary dysplasia. And those are usually kids that are born early. They're not born at their full term, 40 weeks, and their lungs haven't completely developed. And so their lungs need to take some more time to grow as their bodies grow. So I think that's probably the most common that I've seen is the BPD.
Right. That and the common cold probably.
Yes.
Yeah, it is amazing to me to this day how many people present in the ED, the ER with, whether it's a stomach virus or it's a cold, about which they can do virtually nothing except say,
Yeah,
we're sorry you feel this way, but
it's a cold.
It's
Yeah. I think that's part of the problem of why the ERs are so crazy. I think that's part of it. I think some people don't have insurance, right? So they can't go to the urgent cares. They can't go to the doctors. So they go to the ERs and tie up the ERs. And so that's kind of what we have to figure out in the healthcare world is how to try to avoid that, because they're tying up the ERs for the people that really need it.
Right. Then the last question I see for right now is, do health companies provide pediatric workers with mental health breaks? And I would generalize that to say, do healthcare institutions provide all types of workers with mental health breaks and other support?
Yeah, so I know Nemours does, and I know where IM does as well. We have an employee assistance program that provides us with that specific mental health program. They have counselors on board. They have all kinds of resources that you can utilize for support groups if you have some type of something that you want to work on, whether it be mental health or some type of, I don't want to say addiction because that's not the right word, but some form of process that you want to work on. They have employee assistance programs that are available to you.
Right. So substance use, misuse,
Yes. Mm-hmm.
behavioral health issues.
Yes.
All righty, well, unless anything else, nothing else popped up, so I believe that for this evening, we are done. I'm going to go back to sharing screen for a second here. And thank you very much, Taryn, for your presentation and letting everyone know that next week, December the 5th, we're going to be hearing from Shalini Shah, Dr. Shah, working in family medicine. And for those of you who attended the last series, you heard from Dr. Margot Savoy. So for those of you who have attended both series, you'll get another dose and another point of view on the importance of family medicine. Thank you, everyone, for joining us. Have a great night. Take care.
Thank you.
Bye-bye.